The Minnesota Association of Health Underwriters has said that the increases for next year within MNsure are going to be between 8% and 43%.
After years of being a behind-the-scenes player, the Minnesota Association of Health Underwriters is speaking out, helping to bring a valuable perspective of health insurance agents to the public. The public relations initiative began as we entered October, amid mixed reports and growing concerns as to what was happening with MNsure. A news release was developed reporting on the concerns of agents, and past President Alicia Rydell and Heidi Michaels went to MNsure's October board meeting and urged the timely release of real rate information for renewals. They explained that the alleged average rate increase put out by the Commerce Department was misleading, false, and incomplete. Their comments and interviews afterwards brought news coverage from all over the state of Minnesota, led by the Star Tribune and the St. Paul Pioneer Press. Dozens of news stories on MNsure with input from MAHU have appeared in newspapers around the state, from Faribault to Fergus Falls and St. Cloud to Crookston to Duluth. And reporters are getting back to us for comment on new developments, and that is very positive.
The lowest rates in the country, or will skewed numbers leave Minnesotans facing a harsh reality? When MNsure revealed its 2015 insurance rates last week, we started asking questions. The average increase of 4.5% seemed a bit skewed, and now insurance brokers are saying the same thing. So we want you to know what to watch out for when you shop health insurance starting on November 5th.
And insurance brokers say Preferred One, which pulled out of MNsure, had 32,000 MNsure clients who are not even counted in the 4.5% average for next year.
I would argue that in order to get an accurate view of what the average increase is, we should be looking at the plans that those individuals are on that purchase through MNsure, and we also need to include Preferred One.
Insurance broker Heidi Michaels has dozens of MNsure clients. Now, she showed us one with a 43% increase and another with a 29% increase in their monthly health insurance bill. This is her best advice for you, the consumer who uses MNsure.
If this plan does not meet your budget any longer, you are going to have to choose a plan that has a more limited network, a higher deductible, higher out-of-pocket limits, and just have an understanding of how that's going to impact your financial situation.
And the insurance industry sent a letter to Governor Dayton urging him to tell the vast majority of their customers they will see a much higher than 4.5% increase.
If you're talking about it, she's talking about it. For Dana Green on News Radio 830 WCCO.
I know it's been a little depressing about the health care, despite what some politicians say. Lowest rates in the nations, you're going to get the best deal. Fact of the matter is, with the very latest numbers from the Golden Valley-based Preferred One, which bailed on MNsure last month, they said, oh yeah, we're good. We're going to insure most of you. They bailed. They say the administrative cost for the customers was too high. Alicia Rydell is a past president of the Minnesota Association of Health Underwriters, or MAHU.
Again, the reason you want to talk to an agent is because they're licensed and because they are, they're in this every day and they can help make those assessments with you, especially if you're a current MNsure enrollee and
Sure.
You have a current policy. There's uncertainty within with MNsure of whether or not their renewal website, so somebody that currently has coverage will be able to go into the website and actually get information about plan comparisons and subsidies and those sorts of things. We're not going to know for a couple more weeks. Working with an agent, they can help you walk you through some of these scenarios.
Chad Hartman, Kyle Sheely in for Dan Cook, who's off. This is something that should be bugging plenty of people. Where are we at with the increase, the MNsure rates? Let's bring in somebody who knows as well. She's the chair of the Minnesota Association of Health Underwriters, Alicia Rydell.
It's really important to us, the group that I represent as agents and brokers who are on the front line working with their client. But what I can tell you is that the overall increase that was announced early in October, being 4.5% for policies in MNsure, is inaccurate, in my opinion, and irresponsible, because that will lead consumers to believe that they are going to receive, small increases for their health insurance for 2015. And when their agent or their insurance carrier presents them with their renewal and they see the number 63% or 40% on that renewal, that's a tough thing to help them understand when they heard the governor say 4.5%.
Jennifer Leverins, WCCO.
Minnesota Association of Health Underwriters has said that the increases for next year within MNsure are going to be between 8% and 43%.
Health insurance sticker shock.
Alicia Riedel of the Minnesota Association of Health Underwriters told the MNsure board that brokers have started to receive renewal rates from Preferred 1 for 2015. She says for many people that could mean health insurance rate increases in the 60% range if they stay with Preferred 1.
You got to remember that the majority of consumers who have individual health insurance policies did not buy them through MNsure. Most of them are outside of MNsure at this point, and so they haven't received their renewals yet. And as they start to receive them, they're going to understand that they have significant increases facing them.
Customers who have health insurance through Golden Valley-based Preferred 1 may be in for sticker shock. The health insurer says customers will see average premium increases of 63%.
Bottom line is bad news, obviously. And I don't think it's different for other insurance companies as well. People are seeing increases across the board regardless of the carrier that they have for their policy, but they need to talk to their agent about what their benefit options are for next year and what will meet their budget.
More than ever, agents are presented as speaking up on behalf of their clients, people who are looking for necessary and comprehensive coverage at a realistic cost. And others are recognizing agents as sound sources of accurate information who provide personalized service.